right, welcome to this edition of the Pine Belt Women's Expo. In the meantime, we are featuring our exhibitors and sponsors until we can meet again in person. And today we're featuring our photo booth sponsor. And sadly, we can't meet in person to actually do the photo booth, so
I
we will
know.
meet virtually. I have Brienne Whitney with me here today. She's with Maxem Health Urgent Care. Welcome.
Hey,
So
I
glad to
hate
have
that
you.
we are the photo booth, the one thing of all things that you especially can't do during this time.
Nope, can't get
But
close together. We could do a
yeah,
virtual photo booth. That might be actually fun. We've had so much fun with the photo booth over the years. I was looking through it actually, looking through our old photos on Facebook.
yeah.
And as I was flipping through, going back, a few years ago and then looking back now, I noticed there are like some people I could see like children like growing up, in the pictures.
Oh,
It is
oh,
really, really neat. And like moms and daughters year after year, or
yeah.
just friends year after year. I mean, I've seen people who've passed away in those pictures and the
Oh,
memories. It is really
it's
moving.
yeah.
Yeah.
I we love it. In fact, like we started doing it with you guys, and then we just loved the turnout and just loved the appeal of it. And we started renting them out for events that we would host at our facilities, and just it's just such a fun little thing, and it's just a great memory too, just with the way they can like do the different frames around the pictures, and
Mhm.
it's such a great tool, and we love sponsoring that.
It's evolved over the years, and our photo booth provider now, he has so many different kinds of ways to do it, and it's gotten fancier and fancier and easier to do
Yeah.
them. And now you can make like the movable images, gifs or gifs, however people say those.
Oh
Um,
yeah.
but I don't know, it's just a fun thing to have, and I don't think that will ever go out of style. I just wish we could do it in person, but we will be back
Yeah.
eventually.
it
Um,
it's looking good for next year, at least,
Yep, that's right.
around this
We'll get
time
back
next year.
together eventually.
Yeah.
In the meantime, we'll have masks on and everything else if we do get back
Yeah.
together.
I love
Please
how
get
that's
together.
become so fashionable too. It's kind of, I find myself online shopping like, oh, that one's really cute. I don't have that
Yes.
color mask, or I don't have that. Like,
Oh,
maybe
I've
I need
asked
to.
people, where'd you get your mask? I mean, that what a
Yeah.
weird, weird world um,
Yeah.
that we live in. And our kids wear them to school every day. So it's becoming like a thing, like getting the mask. Well, oh, it's just really strange, making sure
Hmm.
everybody's got their mask for the day. Um, and styles and things. I don't know. It's a weird world we're living in. Would not have imagined we'd be here, a year ago today. It's just
Yeah.
unbelievable.
It is so drastically different than what we've ever experienced in the urgent care. And it definitely threw us for a loop in so many different directions throughout the process of like when COVID first came to now. It's ever changing, and we're adjusting weekly with everything that's coming on.
That's interesting that you say that because had I interviewed you in the beginning of this, like months ago, probably would be different than even now that we've been in it
Yeah.
for 8 months or however long. Well, I guess first tell us about the company and like what it is in normal times and kind of what you do. And then I want to get into like how things have had to change and evolve. But first, what is the company and what do you do and who can you
Okay.
help?
So we are Maxim Health Urgent Care. We just started branding ourselves probably around 2015 with that name. Prior to that, we had maybe 3 or 4 urgent cares that were just named based off the city that we were in. But we just kind of ballooned throughout the years and just kept expanding and expanding. And we just are there to offer, we're an independent company. We want to make sure we aren't associated with hospitals, just because we find a lot of our patients have bad experiences with hospitals and prefer kind of like a more local homegrown feel. And that's kind of what we strive for. So we really get involved with the communities, and we work with providers at each clinic that they live in the city that they're working at. So they really know the community, know the patients, and it's very like,
Mhm.
it's just a very homely, like kind of like feeling. And so we've been doing this since 2007. I came on around 2010, and I'm the president now. I kind of manage all the clinics, micromanaging little things. I have my operational managers at different sections, but for the most part, just scouting, trying to keep things running, updating policies, procedures, and just kind of maintaining the flow of the urgent cares. And the goal for us prior to COVID really was just trying to be there for the community, late hours, weekends, holidays, things like that, and offering services that a lot of the hospitals weren't. When you go to the hospital and you kind of have just a basic cold, a lot of them get upset or turn you away because it's just not an ER kind of diagnosis. They're like, what are you doing here? So, and primary cares aren't open a lot, especially during the holidays. The doctors take vacations. They go to like, I'm sorry, my phone's all thing, but there's a lot of things that the primary cares just don't open for during the holidays. They'll be closed early due to weather, due to family stuff. Weekends, of course, are closed. So we really are just there long hours for the patients that have nowhere else to go. And we were introducing our medical discount program. That was one of the things that we introduced a couple of years ago for patients with no insurance. And it's basically a program that a subscription service like a gym, where whenever you go to any of our locations, you can be seen by paying this monthly subscription and a copay. And we give them x-rays, injections, flu swabs, anything like that. There are some exclusions, but for the most part, everything done in-house is covered. So without insurance, you can just be seen at any one of our facilities. And since we have them in Louisiana, if you're on vacation in New Orleans and get sick, you don't have to worry about, not having insurance. You can go to one of our clinics and still be seen and treated.
Program. Wow.
And that was our main focus before COVID, was just kind of finding little things like that will help benefit the community, and, lowering our prices, trying to get new services. And then COVID hit, and been a lot of readjusting, but
wow, that's great.
That's kind of the goal.
Model. The subscription model is a neat way to help people who may not either don't have insurance or just want a different way of service.
Initially, it was something I created that just started out for people without insurance, because we had a lot of people that just couldn't afford our prices, and we try to make our prices very competitive, but it's really hard sometimes when we were buying medical supplies, when they raise our prices, to be able to adjust to that. So with this program, we really wanted to get that demographic seen and treated, because we didn't want them leaving because they couldn't afford it. But we also didn't want them, we couldn't afford to just see them for free like we were doing, essentially. And so we created this, and it ended up turning into something completely different. So we get a lot of people that actually use our program for that time period when they're trying to get insurance. So it's really turned into a great plan for people that just started a new job but need insurance right away and won't be able to enroll until December. So, because you can cancel anytime with our plan, and they've used it for that, and they just cancel when they get their new insurance, and it's become a really great platform for that. And now they know where we're at, and you can use us once they get their insurance with their companies.
It's a really great plan. You can enroll your whole family, I'm guessing, in it if you want.
Yeah, we actually just created that, a family plan. So it's a little bit higher than individual, but it's still like you're paying a $10 copay for your kids, and like it's tiered for your family.
That's great. I know that's one thing whenever we have insurance, but still, like, when the kids are hurt, it's like, is this a doctor's visit? Do we really have to, and to have that kind of peace of mind where, you can pay this copay and these things are going to be included, then you're a little more willing to go, and check on that cold. Or now I almost feel like I want to go every time they have a fever. Do we check for COVID?
Yes.
So it's so different, and to have that comfort to go in and, you're not going to have to pay whatever the normal just rate is for.
It's turned out really great, especially during this time, because people are, is it allergies, a cold, COVID? Like it's so questionable with your like symptoms. So it really, I think, has eased a lot of patients into just being able to come in and make sure they're okay.
Yes. Peace of mind.
Because quarantining is best, of course, once you do get symptoms, but a lot of people can't do that. And a lot of people are with a lot of family in their house too. So it's better to have peace of mind.
That's right. That's a big term right now. So tell me now. So now that COVID has hit, and what has evolved from the beginning of COVID to now, what kind of services have you added? How can people be seen there if they need, like, say they do have think they may have been exposed? What can y'all do to help people with COVID exposure or whatever?
So we were looking into telemed prior to COVID, but once COVID hit, we really streamlined it. So basically, I think it was end of March, beginning of April, we implemented our 24-hour telehealth service. So during our office hours, of course, if you're not comfortable coming in, you could be seen via telemed, and just using your laptop, smartphone, iPad, anything that has like that kind of capability, you can just see us via your phone. And that's not only during our office hours, but also after. So if it's 10 o'clock and you're like, oh my God, I don't want to go to the ER, but I need to know like what's going on, you just go to our website and you can see any one of our providers. And we have a lot of our residents and physicians that will work after hours, and some nurse practitioners will go during the day and stuff, like when it's local. But unfortunately, it is limited to Mississippi and Louisiana, because those are the only two states that we practice out of. But it's increased productivity immensely. With people just love it. I mean, it's just so convenient. And I know for me, like, I don't want to get out of the house if I feel like something's going on. So that has really like helped.
Especially your vulnerable populations. You don't want them
Yes,
to
yeah.
even
And
they
we
don't have to.
Yeah, especially, and we found with our like nursing homes and local like communities like that, a lot of them just need refills or like a quick, urine check is like a huge thing. So we've also like dropped off supplies at local nursing homes and companies like that. So we're like, hey, these are our supplies. If you need them, you can always have someone run them to us and we'll get them checked. But don't come to the clinic. Make sure you're safe and just let us know what you need.
That's
So
great.
we have increased our on-site capabilities at our clinics with COVID. So we actually will take our stuff, our COVID supplies, our blood swabs, our blood tests, all that stuff to the site itself and run those tests and do those physicals for them, give them flu shots. So we've increased our on-site capabilities tremendously. And it is something a lot of people don't know that we offer. So if you have like say you work at a small boutique, but everyone wants to get checked for COVID, like just let us know and we'll come on site.
Wow.
It's just easier to
That's
group
great.
them that way than have them sporadically come through the clinic.
Yeah.
Then it makes more sense. And we really do like work around whatever their schedule is and really try to help.
That's great.
So what we also offer, I guess like all COVID testing now. So we have there's 3 options. 2 are the best. And the best one is the PCR swab. And that's the one you see about on the news. That's really uncomfortable. And it's the one that goes deep nasopharyngeal, but it is the golden standard. It is the most accurate test. We take about 24 to 72 hours to get our results back because they are send out labs. But we just recently we got our rapid COVIDs, and those are getting higher in accuracy, but they are still something. If it's a negative, like we do want to do a follow-up test and we do a swab just to make sure, especially if you have symptoms, because we want to make sure it's 100%. And those are a 15-minute tests. It's really quick. A lot of people request those. I know for some travel agencies, they don't allow those to travel. You want to get the PCR, but it all depends. They usually give you a guideline of what they're expecting from you, and we can offer any of those. And the final test that we do offer that it's not as popular anymore, I think as more information has come out, is the antibody testing. It's just so all over the place, and COVID is such a new disease that we don't know much about it. And we're trying to get as much data as we can with the antibodies, but it's showing that antibodies leave your system after a couple of months, and sometimes people don't develop them right away. And so it's a really difficult test. It's something we do offer if you're curious, but we don't really promote it as much anymore just because the data is just all over the place, and we would feel more comfortable until we got better data about it. But yeah, we do all of that. And it's just,
do people need to make appointments for the COVID testing?
We don't. We are a walk-in clinic still, and we give a few options for testing. So if you're not comfortable coming in and you want to be tested, you can just call the clinic and we can come out to your car to do the testing. We kind of leave it up to you. We prefer everyone come in with a mask, just because for us and our liability, and just to make sure we're comfortable, we like to do a full evaluation. We want to make sure these symptoms are accurate. They could actually be a COVID thing, or it might be something else. And there are tests that we might need to do, like a chest x-ray, maybe another flu swab or a strep if it's hopefully that. And so we prefer a full evaluation, but we also understand some patients aren't going to be comfortable with that. So we really try to work with the patient and their comfort level on that situation. But we do both. We prefer them to come in because we clean and sanitize our rooms after and before every patient. We have a company that comes in actually once a week and really does like a big COVID cleaning. And of course, we have our mask on all our employees, and we require it for our patients. Most of them are coming in with masks, but if you don't have them, we supply them as well.
It's great. Well, this is great. I think this is really good information for everybody to have. And we appreciate your involvement in our expo every year. And we can't
Yes,
wait to do it again in person.
I know. We have so many events coming up, and they're still, fingers crossed coming up. Like Peter Anderson on the Coast is
Yeah.
this weekend, and then the
Yes.
Picayune Fall Festival is this weekend too. And it's going to be interesting to see how it looks. It's just something we've never experienced before, and I think these are the only events we have had that haven't been canceled yet. So
Right. I
we'll
think
see.
we're seeing a few fall events coming here at least
Yeah,
in Mississippi. I know in a lot of like tighter like places with more population, it's a little bit harder to do events, but I think we can hopefully spread things out pretty good here. But it's still different, definitely different.
yeah. It's just uh, there's that fear, but there's also just that like it's just unknown.
Mhm.
It's just a weird time right now. But I mean, if anything, we've done amazing. Like the patients and just like the communities here have been incredible during this time and understanding and just helpful. Like it's been, I think, such a close time. I feel like even though we're social distancing, but like it
Right.
feels like we're closer during this time with our patients because it's just like we know them more. They're coming in more
Hmm.
often. We're seeing like their history. We're hearing about their families, and we're getting to know them on a deeper level than we did before. And it's just it's a new and amazing experience, and hopefully
Yeah.
it gets better for us. And of course we get the vaccine, which
Mhm.
eventually once it does hit the market, our clinics will be providing those, but
That's great.
it's going to be a while before that. But
Wow. Well, thank you very much for this information. And if anyone has any questions, I'll put links in the description here. Um, on this is available on our social media networks and on YouTube. So I'll put all the links. And thank you
okay.
so much.
Yeah, thank you.